As we age, you may see that the veins on your legs become a little more noticeable. A lot of folks don't know what to do to change it, so they live with the unhappiness of how their veins look. Well, I'm here to tell you, you can be proud of the way your legs look again, thanks to the experts at Elmore Medical Vein and Laser Treatment Center. Here to explain, we have Dr. Mario Gonzalez of Elmore Medical. Doctor, so good to see you.
Nice to be here. Thank you for having me.
And I read that you guys are so specialized and the only practice of your kind between San Francisco and LA?
We are the only practice that does exclusively vein work. There are several other practices that do a little bit of vein work here and there, but
yeah,
we have dedicated our practice to just veins since 1990.
That's incredible. Okay, well, let's talk about veins because I know there's many different kinds. Can you kind of break down what we're seeing that we don't like? The spider veins versus varicose veins?
Well, first of all, veins are a wonderful thing.
Yes.
Veins have that job of bringing the blood back up to the heart and lungs to get reoxygenated. So veins are supposed to be good, but like anything else, they can have problems. They can break down a little bit, and when the veins do break down, they can cause some reasonably significant problems, not only cosmetically, but as well as health-wise.
Yes.
Most people are familiar with the veins when they start popping out of their skin.
Yeah.
You can have those little bulgy ones that pop out. Those are called varicose veins or bulging varicose veins. Those can be tender. Sometimes they're not so tender.
They look painful.
They can be painful depending on what areas they are. And then we also have small little cosmetic veins that we'll start to see a lot of times after having children, really. Although I say that, men get them too.
Yeah.
At least 20 or 30% of our practice, we cater to men and their vein problems.
And it kind of looks like a road map, right? Or a spider?
It does, and we call them spider veins.
Spider veins.
We call them spider veins because they do kind of look like little roads, or almost like a root system. And then you can also have what looks like blue lines under your skin. And those are varicose veins too. They just have a kind of a different, more specific name.
Well, doctor, we're looking at some of your patients before and afters. This is incredible work you've done.
On the left, you see, those are the bulging varicose veins, and those have been there for a while. They're pretty good size. And on the right is an after shot after I've removed those bulging veins.
Whoa, I can't imagine what you do. So to smooth this, is it lasers? Is it surgical? It's a mix of everything?
It's a mix of everything. Very specifically, to take these bulging veins out, it's a minor surgery. I numb up the area around them, and with a very, very tiny little incision, I can pull them out.
Whoa, and obviously, and keep the vein intact.
That vein is dead anyway.
Is it?
It is. We are blessed with so many good veins that taking out some of the bad veins is only helpful.
Oh my goodness. So how does one get something that bulging?
Well, there's a big genetic component. Okay. So if your mom or dad or your grandparents had varicose veins, there's a chance that you could get them. And what you inherit is a weakness or a fragile state of little tiny valves inside the veins. When those little valves break, the blood has a tendency to go in the wrong direction and cause bulging.
Wow.
Now, we see that a lot of times after childbirth as well. When the hormones are up and fluctuating during pregnancy, the veins will open up more to store water and extra blood.
Yeah.
And when they come back together, sometimes they don't come together. They don't come back together very well.
Wow. And what about the myth of crossing our legs, which I do frequently? Does that cause some vein troubles?
It usually does not.
Okay.
No.
They've told me that since high school.
That's more of a myth. What can't cause them is sitting for long periods of time.
Okay.
Or standing for long periods of time.
So you want to mix it up?
You want to mix it up. If you have a job where you're sitting 4 or 5 hours at a time, you want to get up every hour, hour and a half, walk around for 10 minutes.
Wow.
If you have a job where you're standing without really walking, you want to move around.
Whoa.
So I see a lot of teachers, a lot of nurses, a lot of hairstylists.
I bet.
I see a lot of folks that, are sitting behind the desk with computers, a lot of clerical.
Yes. Well, let me tell you, life is too short to be embarrassed about your legs. And we use our legs, we want to be proud of them. So what's the best way to make an appointment?
You can make an appointment very easily by calling the office. We have a website that'll that you can look at to see if anything looks familiar. It'll also give you some of the symptoms because it's not just appearance. A huge aspect of the problem is the achiness and the heaviness of the legs, the swelling down low.
Yeah.
You know, when you start to see changes like that, there's a good chance you have some vein problems. And I got to tell you, the vein disease is very common. At least 40 to 50% of the population has vein problems. And private insurance companies, as well as Medicare, all the carriers will cover expenses when they have to do with your health.
Wonderful.
So.
Yes, I see here 1 in 4 Americans suffer from varicose veins. Wow. Well,
and that's just going to go up and up and up, especially as the average age of our population goes
increases.
up a little bit. Yeah.
Well, I know your patients say you are friendly, your staff is warm, and you are just wonderful at what you do. So
well, I appreciate that.
We're so blessed to have you in our valley, and Elmore Medical Vein and Laser Treatment Center, folks, so specialized and just wonderful how they're changing lives. And thanks for sharing that with us.
Thank you for having me.
Thanks, doctor.